Hello, I'm Governor Michelle Lujan Grisham from New Mexico, and I'm delighted to be participating in the Western Governors Association winter meeting. We all wish we could be together, but given the circumstances of our global public health crisis and this pandemic, this is the best way to talk about a variety of incredible issues. And I really want to thank Jim for his leadership here and by giving me an opportunity to participate and introduce you to an incredible program that I became very familiar with in 2004 when I was the New Mexico Secretary for the Department of Health. It is my distinct pleasure in introducing for this winter meeting this panel on ways to broaden our technology presence in a way that allows us to do better by the pandemic, and certainly in doing so by making sure that we are connecting all of our clinicians and giving them the kind of support, right, and technical assistance that they need to leverage, particularly now when every single state in this country is really focused and, frankly, dealing with incredible difficulties managing access to healthcare, hospital care, screening, testing, and we're all preparing to do vaccine distribution. So every state finds themselves managing this crisis in the context of their own healthcare, both opportunities and too often, particularly for Western states, our limitations. So I think you're going to find this panel incredibly beneficial and useful. I hope you find it as such. I know that I'm going to learn even more about programs that have initiated right here in my beautiful home state of New Mexico. As we get ready to introduce our keynote, for the panel, I do want to highlight Governor Mark Gordon, who frankly needs no introduction to Western governors or the Western Governors Association. His participation in this panel shows his leadership in innovation and technology. He's known as a global leader in energy innovation, and like all governors, he's doing incredible work protecting everyone in Wyoming and participating with all of the governors across the nation to do the best possible work in managing and responding to this pandemic. So with that, I'm going to ask Governor Gordon to give some opening remarks. Governor Gordon, it's lovely to see you.
Governor Lujan Grisham, it's wonderful to see you as well. And you do have a beautiful state. My dad spent a number of years there in Kenna, New Mexico, rodeoing and doing other things. So I know very much we have similar types of populations and challenges. Your leadership on this front is something that I think we all look to. And I want to thank you for allowing me to be part of this panel. And it's really wonderful, Jim, to have this opportunity to be with Western governors. We all face serious issues with this global pandemic, and we're all trying to deal with it in certain ways. Many of us have very rural populations, and the challenges we see, particularly here in Wyoming, I'm really excited to learn more about what we can do with tele-mentoring, telemedicine, to be able to make a difference for our populations right here in Wyoming. You know, this year we deployed over $55 million to build out broadband so that our rural hospitals, very small hospitals serving localized populations, can have access to the type of technical expertise that we see in institutions both inside and outside of our state, not just for COVID, but also for things like stroke and heart attack. We've had a tremendous uptick in obviously demand for telemedicine. Seems to be one of the ways that we can handle and adjust for the challenges that we see. So with that, Governor Lujan Grisham, let me turn it back to you.
Governor Gordon, thank you. You're awesome, and you're welcome, not during a pandemic, but right after, to come back and visit us here in New Mexico. And again, it bears repeating These efforts, these educational efforts and opportunities to share information are critical, but we all wish we could be doing this in person. And frankly, the benefit of the Western Governors Association is we find ourselves in a very bipartisan fashion working through any number of challenges, because the Western states, in fact, per capita, do have less healthcare delivery options given the rural nature of our states. So what makes us unique and beautiful and very popular in the context of these rural, agricultural, energy-driven aspects in our states can present some very unique challenges for healthcare delivery, and certainly during a pandemic, which is why I'm so delighted that we're talking today about Project Echo and about an incredible physician who is a faculty member and sees patients and is an innovator and a researcher and a scientist, and someone that is now known worldwide, but is somebody that we actually consider a New Mexican. Dr. Sanjeev Arora, I think, came to New Mexico in 2003. He's going to talk to us a little bit more about that. And he's a liver specialist. So in helping us attack any number of chronic care conditions in our state, not the least of which is hepatitis C, he became incredibly interested in looking at innovations to take his specialty care and his unique educational and patient experiences and provide them directly to clinicians statewide who weren't able to provide in a primary care practice the same level of expertise. So that meant that patients were waiting, patients were having to travel great distances to see specialists like Dr. Arora. He has leveled the playing field, and he's done what we really need done. He's created access points by something that he will talk more about, that we refer to now through Project Echo, tele-mentoring. And I think that you're going to get to know Dr. Arora by virtue of this panel, and I want to make sure that you get to hear from him. So, Dr. Arora, I've known you for years. You're an incredible asset. Talk to folks about what brought you to the University of New Mexico and what brought you here in the first place. And then talk to us about, how you got to Project Echo a little bit.
Well, thank you, Governor Lujan Grisham. Thank you, Governor Gordon, for this opportunity. It's really a pleasure to spend time with both of you on this network today. I was living in Boston, in Massachusetts, a faculty member at the University of New Mexico. At a university in Boston, and I got an opportunity to come to New Mexico as the chief of the section of gastroenterology at the university. There were two reasons I came to New Mexico. One was, of course, a lovely sunshine here. And second was this issue of there was an opportunity to serve a large numbers of underserved patients, which I didn't have as much opportunity in Boston, in Massachusetts. And in early 2000, I'm a gastroenterologist, and I was seeing a patient in my clinic. And I walked into the clinic, and there was a 43-year-old woman who was sitting there. And I asked her, how can I help you? She also had two children sitting in the room. One was a 14-year-old boy, a 9-year-old girl. And she said, I have hepatitis C, and I want treatment. So I said, how long have you had this disease? And she said, I've had it for 8 years. And I said, why did you not come earlier? We've had treatment for 8 years. And she said, I live 200 miles away. I called your nurse. There was an 8-month wait to see you. And she said, you would have to make 12 trips to see us at the university, 200 miles each way, while you were getting this chemotherapy-like regimen, weekly injections and pills. And she said, I had a 1-year-old child. I'm a single mother. My car is old. There was no way I could come 12 times, taking so much time off work. So I decided not to get treatment. So the next question, of course, was, why did you come today? And she said, I'm having pain here in the right upper side of my abdomen. I got very worried as a physician now, and I did an ultrasound, and she had a cancer of the liver, slightly smaller than the size of a tennis ball. This was now too large for us to do a liver transplant. And She already had cirrhosis. We could not remove it. And she passed away 6 months later. And I asked myself, why did she have to die of a curable disease in the United States, where all the medicines were available, where all the diagnostic tests were available? And she had insurance. And the answer was she died because the right knowledge didn't exist at the right place at the right time. And she didn't have the ability to get to the right knowledge. So this is how ECHO started. At that time, there were 28,000 patients diagnosed with hepatitis C. And it was just only 1,500 had been treated. And this was happening to me again and again. Every year, 50 to 100 patients would show up with cancers or cirrhosis and would pass away due to the hepatitis C. And I was kind of frustrated. I said I needed to treat a lot more patients, but I couldn't because my clinic was full and it was an 8-month wait. And that's why I developed ECHO with the idea to getting the right knowledge at the right place at the right time for every single patient with hepatitis C in New Mexico. And that was the birth of ECHO. And after we started it now, tens of thousands of patients have been treated. And this has been how actually we now have been able to change healthcare in many parts of the world.
So, Dr. Arora, of course, you and I met, if you might recall, in 2004, and I wanted you to cure every Hep C patient in New Mexico. And we really did talk about this right care, right time, right place effort. And quite frankly, while we haven't achieved total success in removing every obstacle or barrier, the stories that you have told are heart-wrenching, frankly, because they are so true and they occur in every state. At some level, we have access point problems and a division between primary care and specialty care, and really figuring out ways to leverage the expertise that, frankly, most of our physicians and practitioners have. They just need the support, particularly in doing the treatment phase. So once they do a diagnosis, help me through that effort. So talk to us about how this is a bit different. So, man, maybe walk us through this tele-mentoring concept that you've developed through Project ECHO, which now New Mexicans, including me, we all take credit for Dr. Arora's work. So he's a highlight of our success in our state to provide high quality specialty care when and where appropriate, and by supporting all of our rural clinicians and rural patients in our state. But talk to us about the difference between telemedicine and telehealth, and what we talk about in the context of ECHO, this tele-mentoring, and then how that all by itself creates exponentially the opportunity to serve more patients.
Thank you, Governor. First of all, I want to recognize you because of your enormous support when you were the Secretary of Health, as a Congresswoman, and now as the Governor. We wouldn't be here where we are today without your support. So telemedicine is a huge advance, as you know, because in the COVID-19 world, so many of our visits are occurring on telemedicine, which I describe as a one-to-one interaction between a specialist and a patient in a rural area or an urban underserved area to help the patient. And this is extraordinarily beneficial because the patient doesn't have to come into the clinic, get infected, patient doesn't have to travel, and it's a very big advance, and I do that too. ECHO is different, and the reason why ECHO is different is it's a tele-mentoring platform where we are not giving people fish, we are teaching them to fish. So why is it tele-mentoring is essential? We know that in the public hospitals in the United States, across all 50 states, on average, there is a 6 to 12 month wait to see a specialist. We know that the need for a specialist opinion is going up dramatically in the United States and all over the world. The evidence for that is that when I look at the Medicare database, we see that over the last 10 years, the request for a specialist referral has gone up 3.5 times compared to the number of specialists, which haven't gone up nearly as much. And this is because of an exponential growth in knowledge that is occurring, which is because of science, and it's having a very hard time reaching the last mile of healthcare, leading to long waits for patients in rural areas and urban underserved areas. So the purpose of ECHO is what we call force multiplication. That is, how do we exponentially improve the capacity to deliver best practice care? Telemedicine doesn't do that in itself, because if I'm seeing a patient over a camera directly, then I'm seeing one less patient in my rural area, in my clinic here at the university, and there's a wait here. So what we decided to do was we said, what if we created a new model, which we call ECHO, where I would have 25, 30 primary care clinicians join me simultaneously on an interactive video network, and one by one present patients in a de-identified way to each other and to me and my team at the university. And once a week on Wednesday afternoon, I started this session. And every 2 hours, we would discuss 8 or 10 patients. We would advise these clinicians on how to manage these patients. And we would do this week after week. And what we did was we had now created 30 new centers of excellence for treating hepatitis C in New Mexico. And the wait in my clinic, which was 8 months, started falling, and it fell to 2 weeks, and thousands and thousands and thousands of patients got treated with very high cure rates. And what we found was that all 30 of these clinicians had become experts. And everybody in the town where they lived, instead of coming to see me at the university, were now getting care by their local primary care providers in their local communities. And we demonstrated in the New England Journal of Medicine, which is the leading medical journal, that essentially they could provide the same level of care as university specialists. And the capacity to treat had gone up, hepatitis C had gone up tenfold or greater. And this was the birth of ECHO, and that's tele-mentoring versus telemedicine.
Dr. Arora, thank you very much. Now I'm going to, like all good quarterbacks, I'm going to throw a pass right back over to Governor Gordon for the next couple of questions.
Thank you, Governor, and Dr. Arora. Really exciting what you're talking about. An incredible expanse of opportunity, and I think about it in a very personal way, because when you have somebody that's in a local community that has to travel miles to your clinic, and their family is very concerned about them. You've really given them an opportunity to kind of get care in place. What I wanted to ask you about is, I understand it's expanded beyond the borders of New Mexico and many more conditions. So I guess I just was curious how it's expanded, and two, are you doing more than just what you were doing?
Thank you, Governor Gordon. And of course, we have a lot of ECHO going on in your state of Wyoming, and actually in every state covered by the Western Governors Association, we have ECHO projects. But the first thing we did was we started an ECHO for opioid addiction and substance use disorders, which was causing hepatitis C. Next for diabetes, then for high-risk pregnancy, and for HIV, and so on and so forth. And essentially launched about 30 networks in New Mexico. But then we set up a goal. We said, look, we want to help 1 billion people. And we had a problem. There were only 2.3 million people living in New Mexico. So I said, okay, we're going to train every academic center in the United States and the world that wanted to do ECHO. We would give them our technology platform. We would train them to do ECHO. And now we have ECHO going on for 70 different disease areas like TB, mental health disorders, geriatrics, etc., all over the world. And we have 425 hubs like the University of New Mexico that do ECHO. We have about 1,000 networks in the world and learners in 165 countries. In the last 9 months alone, 750,000 learners all over the world have participated and being mentored on ECHO networks. We also work in Africa in about 40 different countries to enhance global health security, strengthening laboratories, and many, many different areas now. And it is rapidly growing at an exponential pace. In 2020 alone, our growth is 400% over 2019.
Dr. Arora, that's just sensational, and congratulations to such a great effort. You know, I think about it in terms of the pandemic and what we've seen with mental health disorders. You spoke about those, and I know sometimes it's hard to look at a monitor and see a face. You're really talking about human interaction with telementoring. What role do you see Project ECHO working on with COVID, and then how do you see it going forward?
Thank you, Governor. So in the COVID-19 world, what happened was that all of a sudden, massive amount of knowledge came into play. There have been 23,500 publications on COVID-19 just since February of this year. And a primary care doctor and other clinicians, nurses were having a hard time keeping up with it. So we started ECHO actually first in Vietnam in February for COVID-19. And ECHO is being used for three primary purposes for COVID-19: amplifying the public health response, which means how to use PPE, social distancing, testing, quarantine strategies, how to interpret tests, how to isolate patients, etc. Second, it has been used for treatment. How should you manage an outpatient with COVID-19? How should you manage an inpatient? How to create a COVID-19 floor? How should you, what are the ventilator settings? How much anticoagulation to give? And third, now we are going to be using ECHO all over the world in these 165 countries on the vaccine response. So in the vaccine response, there are three kinds of challenges. One is training a community health care workforce for overcoming vaccine hesitancy. Second, for training a vaccine delivery workforce. And third, training a workforce to manage side effects. And so about 300,000 healthcare workers in the United States have already participated in all 50 states, and another 300,000 globally on the COVID-19 response so far.
Well, let me pass it back to Governor Lujan Grisham then.
Thank you very much, Governor Gordon. Dr. Arora, I really appreciate that. As you know, we got a 50-state independent response so far on what we know about extremely cold storage and delivery of a vaccine, and even the two vaccines that now appear to be incredibly effective are going to require 2 doses. So just giving your description about how you are managing that education and support to so many countries, so many practitioners, and so many states is exactly what we think we are reaching for. We want to create access to solid, sound, evidence-based information. We want to support an already strained, struggling set of policymakers and practitioners. And we know that associations like the Western Governors Association is a terrific vehicle to make sure that what you are doing and their opportunity as governors in their own states, that they have access to these evidence-based efforts to do as much as they can for their populations. So talk to me about what you see in terms of Western governors, more than this panel, to continue to get out access and information about ECHO and related projects as we continue to work through the pandemic.
Yeah. Thank you, Governor, for that critical question. I think Western governors can benefit from ECHO in 3 ways. Firstly, independent of COVID-19, moving care from the academic center to the rural area is a major economic benefit to these rural areas because the healthcare is provided locally rather than in the main academic city. Second, we know that programs like Medicaid has time and distance parameters. That means you need to provide specialty care within a certain time, within a certain distance of where a patient lives in a rural area. Most Western states do not meet that criteria, and ECHO can help meet that. But most importantly, by providing healthcare locally to your patients in the rural areas and urban underserved areas rapidly, you provide care at a much sooner time period, and therefore you prevent the disease from progressing, and care can be provided at a much lower cost. What Western governors can do, first, as Governor Gordon said, really ensuring broadband access in every healthcare facility in the state is critical. Secondly, I think that really every one of the Western governors has ECHO in their state, without exception. Supporting the centers, etc., supporting the ECHO projects within your own states to expand, first to COVID-19, but for all other chronic diseases for which you're not meeting the time and distance parameters would be extraordinarily helpful. And lastly, encouraging the federal government to adopt platforms to build and sustain a workforce which can adopt all the massive growth of knowledge that is occurring in the world. Knowledge is doubling every 3.5 years. And so a primary care clinician that doesn't have some kind of connectivity to experts is going to have a very difficult time keeping up with it.
Thank you. All right, Governor Gordon, I think you have the last question.
Well, thank you, Governor, and it's been an honor. I've learned so much. Dr. Arora, thank you for sharing today really important stuff. I'm trying to understand what you see as challenges for Project ECHO going forward, and then also, more importantly, what the opportunities are. And again, thank you so much. I've learned so much.
Thank you, Governor Gordon. I think the opportunity for us is there's been a worldwide competition called the Macarthur Grant for $100 million. And there were 3,500 applications. We've made it to the 100 and now have made it to the 6 finalists in the world for this $100 million grant from MacArthur Foundation. We have serious competitors like ocean health, homelessness, oxygen therapy in Africa, news deserts, mosquito-borne disease, and ECHO are the 6 finalists, and we are hoping we can win this so we can improve healthcare around the world for 400 million people. So that's an opportunity. Another area, we have recently received a federal contract, a very large, it's a $237 million federal contract. Governor Grisham, unfortunately, doesn't all stay here in New Mexico. Only 6 million stays here. But the rest goes out to the 50 states to mentor and train 15,400 nursing homes in the United States on how to prevent deaths there. And we put them in cohorts of 33 nursing homes. Already 6,600 nursing homes have started participating in these ECHO clinics. And so this is a huge opportunity for us to reduce deaths in nursing homes, because 40% of the deaths in the US actually have occurred in nursing homes, even though less than 1% of the population lives there. And the last opportunity for us is we are now expanding ECHO into the field of education, especially in early childhood education, to mentor school teachers, community health workers, and lastly, other school teachers in K through 12. And of course, the challenge for us, of course, is to expand it rapidly all over the country.
Dr. Arora, I shouldn't be surprised that I, like Governor Gordon, learn much more at the end of these panels and some time with you than I did on the front end. And I want to thank the Western Governors Association and Jim for his leadership. Our effort here is to make sure that we have positive, productive exposure to all of the different tools and techniques that can improve the quality of life, the quality of care, and can leverage not just Medicaid, but all of our state's healthcare resources in the most meaningful way. I want to thank everyone who's participating in our winter meeting. I can't wait until next winter when we can talk about all of this in person. And I hope that when we're doing that, we're highlighting even more of the successes through telementoring, through ECHO, and related efforts across this country. Again, I want to thank everybody so much for tuning in, and I wish you a very informative and successful rest of the Western Governors Association winter meeting. Thank you.